And we should be live. Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have a very exciting session with Miss Heather Rich, a dental hygienist. Miss Heather Rich,
Hello.
thank you so much for joining. And on that note, the floor is yours to take away.
Thank you for having me. I'm super excited to be here, I apologize for the technical difficulties. Thank you for your patience. I'm super excited about this. I hope you all get some valuable information from me, and I'm just gonna jump right in. If I can get this to go. Here we go. So just a little introduction on me. My name is Heather. I've been a hygienist for almost 13 years now. I'm here in the Austin area in Texas. I'm originally from the Upper Peninsula of Michigan, so I am a Michigander at heart, but I have been here in Texas for almost 11 years now. I have one husband and 4 children and 2 dogs. It's kind of a joke because I have so many kids and I've had so many dogs over the years. So I used to tease everybody that maybe I'd get another husband or 2. For fun, we love to go boating. We have a boat. There's a lot of lakes here in Austin, so I spend a lot of time out on the lake. And we're a big hockey family. A lot of people don't know that hockey is a big thing here in Texas, but it is. When I'm not at work working on my perio patients, I am running my kids around. So I'm a super busy person. I'm a drumline mom, a swim mom, a dive mom, and a hockey mom. So I have a very busy life. I wouldn't have it any other way. And I'm gonna let you know I love to talk, so just be aware. That's a very important attribute for a dental hygienist. So I'm just going to give you my journey, how I became a hygienist. I get this question a lot from patients. How did you get here? How did you know you wanted to be a hygienist? And to be honest, I actually knew I wanted to work in dentistry since I was a kid. I can remember preschool, graduation, all the kids standing up there saying what they wanted to be. And I wanted to say dentist, but I was so scared because all the other kids were saying, I want to be a teacher and I want to be a nurse, but I really did want to be a dentist. So through the years, I found myself really enjoying every phase of dentistry that I encountered. I loved it. So I loved my dentist, I loved my hygienist, I loved my orthodontist. I just always knew dentistry was my path. Once I got to the college phase of life, I somehow chose the school that did not have a dental program. I'll get into that a little bit later for you, but I ended up actually going to college my first 2 years for an education degree. But it worked out for me in the end. After 2 years, I found my way to my university, Ferris State University in Big Rapids, Michigan, where I got my associate's degree. During that time, I actually went through hygiene school as a single mom, which was pretty difficult, but pretty motivating. I think that's what got me through and really made me who I am today, was having to face that challenge. And it made me very focused and, it paved the path of my goals and what I wanted to do in life. I graduated May 2008 cum laude, and I also received the Community Service Award at our pinning ceremony, which was a great shock to me. I really had no idea that I would receive that award, so it was a great honor to receive that at graduation. That was really awesome. When I graduated in 2008, Michigan really was hit hard. The automobile industry, which is a huge part of that state, had crashed. So jobs were really difficult to come by. I was so nervous that I wouldn't be able to find anything. So I really honestly grabbed anything that I could find in dentistry. So my first job out of hygiene school, I really was not a hygienist. I actually became a treatment coordinator for a local orthodontist. In the end, I truly hated that job, but I am forever grateful that that started my career. I really feel that I gained so much that a lot of hygienists and dentists don't have. There's so much knowledge in orthodontics that lead into dentistry and even dental hygiene. I actually had that job for a good 2.5 years. And through that job is how I got my first hygiene job. We had a periodontist that rented our office at the time, and I happened to be there when he was working and met him. He was changing his day that he used our office for and asked me to come on board. So I had been 9 months post hygiene school without cleaning a single tooth, and I dove right into periodontics with this doctor, starting on scaling and root planings and deep cleanings, um, even delivering local anesthetic. In Michigan, I was licensed to do that. That was pretty scary, but that was one way to jump right into being a hygienist. I worked with that doctor for a good 1.5 years. I got my footing as a hygienist, and then my husband and I decided to move to Houston, where my father and his family lived. So in 2010, I moved to Houston, Texas, and I got my first actual full-time hygiene job for a general dentist in the area. That dentist was a great start into my actual full hygiene career. He offered so many different services. I learned so much from him. I could go into this on another lecture for y'all if you want me to, but I actually found my true passion in hygiene with that office, and that was working with sleep apnea patients, screening for sleep apnea, educating on sleep apnea, referring patients for sleep studies, and working with sleep doctors. It was just an amazing time for me, and it truly is my passion still, and I still work on finding ways to incorporate that into my everyday job. I was with that doctor for a good 5 years. We had a great partnership. I learned so much from him and became so confident in my career in my time with him. But I did have 2 children while working with him. It became quite difficult to make the drive that I ended up finding another dentist a little bit closer to my house, and this was a totally different experience. I found a younger doctor that had bought a practice from an older doctor. And I had the privilege of being the very first hygienist he had ever hired on his own. In fact, this doctor came from Egypt, and in Egypt, they didn't have hygienists. He did everything himself. So I was his first hygienist ever. He didn't even know like how to work with a hygienist. So I had the privilege of helping him build the practice, update the practice, and teach him how to work with a hygienist. It was a very interesting time, but I'm very grateful for that as well. He taught me so much more that I didn't know. He was an amazing cosmetic dentist, very artistic, very compassionate with his patients. It was an incredible experience. Um, Aside from that, enter my education experience and my time becoming a teacher. I actually had the privilege of becoming a part-time instructor at Houston Community College. So I worked 3 days a week as a hygienist, and then my 4th day, I worked as a clinical instructor for the community college with hygiene students. I knew for a long time I wanted to try that, but I had no idea how much I would love it. That was an amazing experience, and it was another way to use my hygiene skills to teach others how to be a hygienist, to share my real life experiences with them. It's something I truly have learned to love, is sharing my knowledge and my experiences with others. So I did do that for a couple of semesters, and in turn decided to go for my bachelor's degree online. My university offers an online bachelor's degree, and so I did start that. As I said, I have 4 kids, so life's a little busy between them and working, so I'm still working on it. I haven't completed it yet, but that is a goal of mine, to finish my bachelor's degree, and that opens up so many more options than just cleaning teeth. So a few years ago, I left Houston completely. We came to Austin, Texas. I found another periodontal practice, and I've been with them for 3.5 years. We recently sold our practice to a younger periodontist. So I am going back through that experience of helping a new doctor build the practice and update. It's just so much fun. It's just so many different experiences that I've had through my time of being a hygienist. So now I'm going to talk a little bit about what a hygienist is. I've shared a couple of technical and very detailed definitions, and then I'll go into my point of view on that. So this first definition is taken from dictionary.com. A dental hygienist is a person who is trained and licensed to clean teeth, take dental x-rays, and provide related dental services and care, usually under the supervision of a dentist. This second one is very detailed. I'll kind of sum it up. It's taken from explorehealthcareers.org. Dental hygienists are preventive oral health professionals who have graduated from an accredited dental hygiene program in an institution of higher education, licensed in dental hygiene to provide education, clinical, research, administrative, and therapeutic services supporting total health through the promotion of optimal oral health. In performing the dental hygiene process of care, the dental hygienist assesses the patient's oral tissues and overall health, determining the presence or absence of disease, other abnormalities, and disease risks, develops a dental hygiene diagnosis based on clinical findings, formulates evidence-based, patient-centered treatment care plan, and performs the clinical procedures outlined in the treatment. I'm sorry, I totally mistyped that. Educates patients regarding oral hygiene and preventive oral care, and evaluates the outcomes of educational strategies and clinical procedures provided. That's a lot of mumbo jumbo, but it was very detailed and I liked it. Here's my take on it. Dental hygienists are the glue between patients and the practice. We truly kind of hold everybody together. Your patients, my patients, they see us more than they see their medical doctor. We really kind of hold everything together with them and the dentist and their oral health. In each state, this definition can vary because every state has a different license. They have a different scope of practice for us as hygienists. As I said, in Michigan, I could deliver local anesthetic. In Texas, I cannot. Some states have a master's program where you are similar to a nurse practitioner, where you can actually do simple extractions and fillings. So the definition of a hygienist can also vary by state. We're the middleman between the patient and the doctor. We spend more time with them than most people, as I had said. I could spend all day giving you different definitions. Ultimately, we are a healthcare provider. We are a friend. We're a therapist sometimes, a counselor, and you're also the doctor's right-hand man. They really look to us to help them through. My doctor looks to me for diagnosis and recommendations, and then he kind of just follows up and decides if he agrees with me or not. Most of the time he does. We're a cleaning lady or man. The list goes on. There's so many things that we do. We're not just somebody that polishes teeth and makes a smile look pretty. Advice for college. So as I said, I ended up at a college that didn't have a dental program. I did 2 years of education. It did work out for me. But my biggest advice from my experience is do your research when picking a school. Preview the programs and the required coursework. Make sure it's somewhere you really are comfortable with going to. Don't just pick a place and just do it. You want to make sure where you go is the right place for you and you're happy with it. If you are pursuing hygiene in particular, understand the difference between an associate's degree, an associate's program, and a bachelor's program. A lot of community colleges offer an associate's program. To become a clinical hygienist, someone that is chairside cleaning teeth, you only need an associate's degree, but there are so many more career options for a hygienist that would benefit from having a bachelor's degree. Set yourself up for success. Know which classes are needed. If this is something you're dreaming of doing and you're not quite there yet, have an idea of what your road is going to look like and get those classes under your belt. I wish I would have been more prepared and had researched more. There are classes I could have taken in high school that would have helped me along the way. I really didn't have my sciences under my belt when I started my hygiene program, so I had a lot of very hard classes to take all at the same time for my prerequisites. Speak to counselors and advisors. I spoke to my high school counselor, but communication was very vague. I wish I would have had more people to help me pave the way. Reach out to other assistant students, hygiene students, dental students, open up that communication, make friends, learn how to organize and prioritize. School is a full-time job. Organization and knowing how to prioritize things is very helpful and very important, and having good study habits. Once I got into the hygiene program, and I tell everyone that asks me about school, it is a full-time job. It really is. My program was Monday through Thursday, 8 to 5, every day. So having a full-time job while in school was not an option. So you really have to be committed to the program. A joke in our community that you really only learn a small fraction of your hygiene knowledge in school, but that small fraction is a lot. It's a lot of information. So you have to be able to commit to that time, because it is very time consuming, but it is also very rewarding. Take a lot of notes. I still, to this day, have textbooks and notebooks that I had in school that I reference back to all the time. Try to shadow as much as you can. I wish I would have known then what I know now. I've had, I count on one hand how many people I've had come shadow me for a day, a week, not even just hygiene students, but dental students. I've had a handful of dental students come spend some time with me, and I really try to give them whatever I can, showing them the teeth, practicing teeth numbers and different terminology and x-rays. And I like to believe I give them a little bit of a head start. I love giving them a real world view of what dentistry looks like. Ask a lot of questions. You don't know what you don't know, so don't be afraid to ask questions. No question is a dumb question, and accept all the information offered to you. My best advice, if you are going into hygiene school, is start collecting patients now. Once you get into clinic, you will have to have so many patients to practice on and do cleanings on, and sometimes it's difficult to fill your chair. So aunts, uncles, cousins, best friends, start telling them to save their cleanings for you. And practice makes perfect. Don't be afraid to ask for extra help from instructors, asking for more clinical time. I actually went to a pharmacy, like Walgreens, I believe it was, and found just a little kit. It wasn't all the instruments, but it was a mirror and a little like scraper. And I had my fake, it's called a typodont. It's like fake teeth that you have. And I would practice on that at home. I would put glue and glitter on pencils and practice like the motions of how to use my scaler. Practice makes perfect. So you do what you have to do to help yourself. And then lastly, have fun. And I actually watched another hygienist shadowing, and she made a good point of make sure you give time for yourself. Don't consume yourself with all of your studies. You need to make sure you have fun, have time for yourself, and take breaks. Don't overwhelm yourself and overstress yourself. Dental school and hygiene school can be very stressful. It can be very hard. Make sure you take time to take a break and enjoy yourself. Now I'm going to give you my typical day. It's going to sound like a lot, but when you've got it down, it goes. It's good. My days actually start at about 7:20 a.m. I'm the first person to the office, so once I get there, I open the office, I check the sterilization area, make sure all of our instruments are ready to go for the day, make sure my rooms are ready, and at 7:30, my first patient is arriving. Times are a little bit different right now with COVID-19 protocols. So when my patients arrive, they used to just walk in and say hi. Now we ask them to call the office, and then I tell them they can come in. We meet them at the door and take their temperature, make sure they don't have a fever, and ask them pre-screening questions. And I take them right to their room and get them seated. To start off the appointment, we always take blood pressure. We always want to make sure our patients are healthy at their appointment. But not only that, we are another person to screen their blood pressure. We can let them know if it's really high. We can check to see if they're on blood pressure medications. There's so many connections with heart health and blood pressure to dentistry. So we do look for that. The next thing that I do is review their health history. I want to make sure that there hasn't been any changes, that there isn't any new medications. So we review that really quickly. And then I ask the patient if they have any questions or concerns for me today, if anything's been bothering them, because that's always priority. If the patient's in pain or they have something bothering them, that's the first thing that I want to look at and take care of. Once we get through that, I begin the intraoral examination. I am looking at the patient overall and I'm getting in their mouth, looking at their gums. So in a periodontal office, that's our main concern, is the gums around the teeth and the bone levels. So I'm really focusing on how the gums look, how everything's looking from the last time I saw them. So I'm checking their gums, I'm probing. That's our way of measuring the health of their gums and bone around the teeth. And I'm making all my recordings. I'm comparing from the last visit and the visit before that to what I'm finding today. And then I'm discussing that with the patient. If I'm finding that things are getting worse, that's a concern and we need to discuss it. If things are getting better, I'm praising the patient for what they've been doing at home and letting them know we need to just keep doing what we've been doing. Once we get through all that, then I start cleaning their teeth. I never clean two patients the same exact way. And I let all my patients know that their cleaning is very personal. So that's why I do the examination first, is I'm looking at everything and it allows me to make decisions on how I should clean their teeth. What are they going to need? Because there's a lot of different instruments that can be used. So I'm deciding in that moment, how am I going to start this? How am I going to clean their teeth? What instruments am I going to use and what's going to benefit them most today? In a periodontal office, we give a little extra attention to areas of disease. If they have swollen gums, areas of bone loss that are bleeding, I'm doing a little bit of extra in there. So I'm getting a little bit further into their gums for their cleanings. And it's just a little bit more involved than a regular cleaning. Once I get all the plaque and calculus off their teeth, I got everything the way I want it, I'm polishing their teeth and flossing. And then in my office, it's very common with our patients to irrigate the gums with an antiseptic solution. We use betadine a lot and chlorhexidine. And if they have an area that has really changed for the worse from the last time, sometimes we'll put an antibiotic in there, something like a Restin. And then at that point in time, any oral hygiene instruction that's needed, I will go over that with them. We carry a lot of patient samples in our office because our patients have more severe needs. So we have proxy brushes and soft picks and all kinds of different dental tools for at home. So I'm always teaching my patients how to use those tools correctly so that I can help them help themselves be better. And then if a doctor exam is needed, I am running around that office trying to find that doctor and wrangle him up to come see my patient. A lot of our patients come to our office every 3 months, so it is very common to not have a doctor exam every single cleaning. Usually we'll do every other cleaning because a lot of times it gets very redundant and then the doctor's coming in to say the same exact thing he said last time. So in our office in particular, we usually do a doctor exam every other visit. And then in between there is just a visit with me and I do my own version of an exam. Then I'm reappointing my patient. As long as I still have time on the clock, I'm setting up their next appointment. I prefer to do that myself just because I know when I want to see my patient. If there's anything in particular I want to check next time, I can make that note on their appointment for the next visit. And then you let the patient go. They go up to the front desk to check out, and then it's go time. You got to break down that room. So we're taking all the dirty stuff, all the dirty instruments to sterilization, taking care of all of that, and you've got to sanitize the room. Anything that you've touched, anything that could possibly be contaminated, we're wiping that all down with disinfectant, and you're setting that room up for the next patient. I am very lucky in my office. I'm the only hygienist, and I have 2 rooms. So I am super fortunate that I can go from one room, it's clean, I let it sit, and I go to the next room and have a patient ready for me, and then I carry on with my day. My days consist of hour-long appointments, and I usually see 8 patients a day. When the patients are done, the day is not over. At that point in time, I have to go back through all my charts and make sure that all my notes are complete for the day, and making sure all the rooms are disinfected and ready for the next day. And then I like to think of our staff as a team. I never just do my part and then leave. So after all of that, I'm checking in with my teammates. We're making sure all the instruments used for the day are sterilized and ready to go. We're cleaning up all rooms, making sure trash is taken out. So it's more than just cleaning teeth. Being a hygienist is more than just cleaning your patient and letting them go. I truly believe in teamwork, and so my job is more than just seeing a patient, cleaning them up, and letting them leave. As a specialty office, it is also my responsibility to keep in touch with their general dentist. A lot of our patients go between our office and another office. So I do try my very best to stay in touch with those offices. Anything I found that day, any areas I want them to give extra attention to, I just write them a little letter, let them know I saw that patient today, this is what I found, this is how they're doing, this is when they're due to see you, and I fax that letter off to that office. And then of course you want to review your schedule for the next day. At least for me, that's very helpful. I don't like walking into a surprise, so I like to know what I'm walking into for the next day, and I'm mentally preparing myself for the patients that I'm going to see tomorrow. I'm going to quickly talk about scaling and root planes because that's going to change the day. So scaling and root planing is very commonly referred to as a deep cleaning by patients. It's just a term that they understand a little bit better. That is also something that I do on my schedule. And if that's put on my schedule, then my day changes just a little bit. Usually those appointments are a lot longer. For the most part, I do the full mouth in one sitting. That's just something my doctors believe in. And we do a lot of oral sedation in our office. We find that it's very helpful to the patient. It makes the appointment a lot easier. They're able to sit through the appointment easier, and when they leave, they have no bad memories of the visit. So it's usually a 3-hour appointment. We typically do oral sedation. The doctor will get the patient numbed up, and then we do preoperative vitals. We get them hooked up to monitors. I do my part. That's usually scaling very deep into the pockets, taking off a lot of calculus, removing bacteria, any antibiotics they may need. And then when they're ready to leave, there's post-op vitals I need to take, post-op instructions I need to give to their ride, and we're setting them up for a follow-up visit to go over oral hygiene instruction. So that's a little bit different than just my 8 patients a day. I usually do 2 root planings a week. It really just depends on the season, I guess you could say. Sometimes we're full and we have new patients coming like crazy, and I have root planings all over the place. And sometimes I can go a couple weeks and not have one on my schedule at all. So it just kind of depends. What kind of complaints do patients present with? In our office, it's pretty straightforward because the majority of our patients have the same thing going on. They have bone loss, they have tissue loss, a lot of recession, a lot of root exposure, and they're fighting gum disease constantly. So very commonly, probably the most common complaint I get is tooth sensitivity. Because we've done treatments to try and get the tissue to be healthier, it exposes a lot more root on the teeth, and those teeth become very sensitive. So we're always battling that. We're always trying new toothpaste, mouthwashes, fluorides, different things to help them with the sensitivity. A lot of patients come to us with bleeding gums, tenderness in the gums, and those are usually the patients that still need treatment. So we deal a lot with gum tissue problems and tooth sensitivity. What kind of procedures do dental hygienists perform? I'm going to kind of go through general and then the ones that I do. Most commonly, a hygienist is known for a regular cleaning, which is called a prophylaxis. It's a preventive cleaning. You're trying to prevent gum disease. So most hygienists that work for a general dentist, a family dentist, this is what they're doing. It's on a patient that's healthy. They don't have gum disease. They don't have bone loss. You're just going in there around healthy gums, removing calculus and tartar and stain, polishing the patient up, and teaching them how to stay in the prevention phase. And then you have scaling and root planing, which I just described as a deep cleaning. It's a more invasive procedure that hygienists are allowed to do. It's non-surgical treatment of gum disease. And then periodontal maintenance is the cleaning that you do after root planing. So your patients that have been diagnosed with gum disease most often will never go back to just a preventive cleaning, because a preventive cleaning is preventing gum disease. Now these patients have been diagnosed with gum disease, so much like high blood pressure or diabetes, you have to be on a maintenance program. Unfortunately for gum disease, we don't have a magic pill that they can take every day to maintain that. So I always tell my patients, your medication is coming to see me every 3 to 4 months and allowing me to get in there and clean up that bacteria and keep it at bay. And we do the best we can. We try to keep our patients stable and maintained, and therefore it's called the periodontal maintenance cleaning. Other things that, oops, I'm so sorry. Let me get back. Other things that we do very commonly is take x-rays. Hygienists and assistants often take the x-rays on patients. In a general practice, in a pedo practice, placing sealants on healthy teeth to prevent decay is very common. Placing fluoride on teeth. I do that very often with my patients with sensitivity. You'll see that a lot in a pedo office as well. Placing local antibiotics. That is also something I do very often in diseased pockets around the teeth. A newer thing, I guess it's not as new, but it's becoming more common, is the use of the laser. So in my practice right now, I don't use the laser myself. I'm working on that with the new doctor. The last practice I worked in Houston, I did use the laser a lot on patients with inflammation and gum disease. And so it's just a laser that heats up, and when you use it in the soft tissue, it's meant to kill the bacteria and promote healing in tissue. That's becoming very common in dentistry and very common with hygienists. And again, it depends on the state that you live in and what they allow in your license on what procedures that you can perform. In Texas, it's a little bit more conservative. We're not allowed to do as much as hygienists in Michigan or Washington or Colorado even. They're allowed to do a little bit more than we can here. But that's what makes hygiene fun, is there's such a variety of things. There's a variety of practices you can work in. So those procedures change. You know, you could go your career working in different types of offices and learning all kinds of different procedures. Diagnostic tests and instruments used. So this first slide, I used it more of what kind of diagnostic instruments can be used by hygienists. And of course, number one is x-rays. That is how we look to see what's going on. We unfortunately don't have x-ray vision, but a lot of what hygienists do is in areas that we can't see. So x-rays are number one there, and that is a big part of hygiene school, is radiology. Another instrument, I haven't used this one in years, but I did work for a doctor that we use this instrument very often in regular hygiene exams, and it's the DIAGNOSTIC. It's a little laser. It looks like a little handpiece, and you just go along the tooth surface, and what it's doing is it's detecting the density of the enamel, and so it kind of beeps. It makes a little beeping sound where there's thinning to try and tell you that's a possible cavity there. So you use the DIAGNOSTIC to look for decay. Another great one, again, I haven't used this in years, but I did work for an office that had the Velscope. I've also heard of Oral ID. It's a machine that emits blue light. You turn off all the lights and you use it inside your patient's mouth to screen the soft tissues of the oral cavity. And this is used for oral cancer screenings. And I've actually sent a patient to an oral surgeon for a biopsy when we found an area that suggested some abnormal tissue there. Of course, my number one instrument in periodontal practice is the probe. I explain the probe to my patients as it's like our ruler. It's a little instrument that has markings on it, and we go around the teeth inside the tissue, and we're measuring how far into the tissue that instrument goes. So for me, that's my everyday. I use the probe on every single patient I see. And then the Explorer is also like every day, every patient, you use that to look for decay. And then I took these pictures the other day at my office. This is what my tray looks like. So these are the instruments that I use every single day. First on my tray, that's my polisher. I'm very lucky. I talked my doctor into getting me a cordless polisher. So it's battery operated. It takes so much tension off of my arm here and the tendons here. I feel like I can polish so much better with that. I love it. Next to that is a little syringe. So if you look behind my tray, you'll see the povidone iodine solution. That's betadine. And next to that is chlorhexidine. Those are like antiseptic solutions that I use inside the patient's tissue. So I just put it in that little syringe and very gently I put it inside the tissue and I'm squirting the solution in any areas that are inflamed, bleeding, irritated. Next to that black handpiece is the ProfiJet. It's an air polisher. For some of my patients that really struggle with oral hygiene, have really dry mouth, they come to me every time with really thick, heavy plaque on their teeth. Sometimes scraping all of that off can be very tiresome to me, very tiresome to the patient. So I'll just start off the cleaning with the ProfiJet, and I describe it like a power washer. It just kind of blasts that plaque right off and it makes it a lot easier for the patient. Next to that gray handpiece is my ultrasonic handpiece, and I will use that on patients that have deep pocketing, heavy calculus. That saves my hands. So it's like my little power instrument. It vibrates and squirts out water, and that will help take off calculus much easier than just hand instrumentation. And then next to that, you can see all my instruments. I love a variety. Being in a periodontal office, I see a huge variety of patients. Some patients aren't so bad, others are very severe. So for me, I really like to have a huge variety of instruments to use during those cleanings. New technology in dentistry. Technology is changing all the time. Being a hygienist of almost 13 years, it's even difficult for me to keep up with it almost. I mean, it's going fast. The biggest one that's been around since I've been in practice is digital software. Now there's a lot of cloud-based software, which is really cool. Paper charts are going out the window. My practice right now is kind of a 50-50, but we are in the next 6 months about to be completely paperless. I'm so excited about that. It's so helpful. It makes things so much easier. Lasers are always changing. And that's huge in periodontics. Lasers that the dentist can use, there's so much they can do with lasers now. Prepping for cavities, for fillings, for crowns, using lasers in osseous surgery and scaling and root planings. Intraoral cameras are a huge game changer. I love intraoral cameras. A picture is worth 1,000 words. And if you can take a picture of something that you see in the mouth for your patient to see it on a big screen in front of them, you don't have to convince them of anything because they can see it themselves. Intraoral cameras are amazing. One of the newer technologies that we have in our office now is the cone beam CT scan, which at this point in time, that's pretty much becoming like across the board essential for periodontics. For implant placement, osseous surgery, there's so much we use these 3D scans for that's almost like a must-have on all of our patients. Some of the other things I've seen, not in our office in particular, but in other offices, are scanners to take impressions. So you don't have to put all that goopy stuff in the patient's mouth and make them gag. What I've always wanted to try, there are probes that you can talk into, and it goes to your software and it will record all the numbers for you. Where right now, what I have to do is ask somebody to come into my room, and as I'm probing the patient, I'm calling out the numbers, and I have to have somebody write it all down for me. So it's hard because I have to have someone available. The list goes on. There's so much technology coming up in dentistry, and it's just going to keep going. I tease my patients that one day there will be micro robots that are going to go in their mouth and do their cleaning for them, and they won't need me anymore. I hope not, but it could happen. Important terms in periodontics. This was a little bit difficult for me because there's so many. So I'm just going to give you the basics, things that I use every single day. Periodontal disease, of course, is number one because we talk about that every day, and that's why our patients come to us. A probe, talking about probing and talking about bleeding on probing is something I talk about with all of my patients. So it's very important to understand what that means and how to educate and relay that information to your patients so that they understand. And attachment loss, that's what we do in our office. Patients come to us because they have attachment loss, whether it's loss of gum tissue, bone loss, both together. That's what we're treating in our office. And bone loss is part of attachment loss. Recession is loss of tissue. Scaling and root planing, that's something we talk about almost daily with patients, and that's the deep cleaning that I was describing earlier. And the periodontal maintenance, that's my day-to-day. That's what I do in our office. So in my office, a cleaning is not referred to as a cleaning. It's referred to as a periodontal maintenance. Osteosurgery is a big one. So before I started working for a periodontist, I really did not understand what osteosurgery was. That was very foreign to me. I worked for a general dentist that did not believe in referring patients to a periodontist. So I was it. Like, I did scaling and root planings and periodontal maintenance, and the patients were what they were. Once I joined the periodontal practice that I'm in now, I really got in-depth education and knowledge of the framework of treating a patient. And so usually that patient comes to me for root planing. I do the best I can. I am cleaning them to the best of my ability, but sometimes their pockets are just so deep that I can't do a perfect job. My instruments can only do so much. I can't see. We give them 6 weeks to heal, and we let them come back and we reevaluate. Some of our more severe patients, they end up having to follow up with osteosurgery, which is what the doctor does. And so much like what I do, he's going to go back in and clean everything. But what he does is he takes a blade and he makes little incisions in the tissue. And so he opens that tissue up, and now he can see everything. All the things that I couldn't see, he can now see. He has better access. And so he's cleaning all of the rest of the bacteria up. If there's a severe defect in a patient's bone, that would tell us that it's going to collect more bacteria throughout the years. He might reshape the bone. We use different medicaments and materials to help regenerate bone. All of that goes into osteosurgery, and that's a big term in periodontics, something that I feel most people that work in general dentistry just don't understand because you don't have the experience with it. It's kind of a periodontal secret. And then, of course, calculus. Calculus is the tartar buildup on the teeth. And that's what I'm doing every day, is taking all that back off those teeth, trying to keep the bacteria out of there. There's so many more. I would just recommend Google searching periodontic terms, and you can find a whole glossary with definitions. There's just so much to it, but it's a really fun area of dentistry. It's very involved. It's very exciting, and it's very rewarding. I mean, we really are doing much more than just cleaning teeth. Patients that are this involved usually have a lot of health problems going on. There's just so much connection between their oral health, their teeth, and the rest of their body. So that's one thing that I really love about my career in periodontics is I am more than just cleaning teeth. I'm really, truly trying to take care of these patients. I don't just ask about their teeth, I ask about their health. We talk about it, we educate them on all the connections. And I love caring for these people and trying to make them healthier. So now this is the fun part. I'm going to give you 2 cases. I could give you so many cases, but these are more recent. And luckily, I had these patients' permissions to take pictures, and I just took these pictures not that long ago. So this first case is a patient I've been seeing since I started at this practice. He's a 46-year-old male. He came to us with a long history of periodontal disease. He had had surgery in approximately 2011. I've been checking over his health history. He has no health history to report other than a minor heart murmur. He doesn't take any medications, but he's got full-blown periodontal disease. We even recommended that he go have his blood checked for diabetes, see if there's any diabetes going on, because it's been an ongoing problem for him that he's been battling. He came to us back in 2018. He had a little abscess, a little infection of his front teeth up here, number 10 and 11, and he had a fistula, which is like it's a little exit for bacteria for infection to try and get out of on a molar over here. At the time, my doctor treatment planned him for scaling and root planing with a little bit of surgery on the upper left, and then we were going to take a couple teeth out. So when a patient's treatment planned for scaling and root planing and they have some surgical procedures mixed in with it, usually my doctor will do the whole procedure. I normally don't get those root planings because he likes to sedate them and just do the whole thing at once. So he did that treatment plan and took care of it in 2018. And then after that appointment, he actually had a pretty good turnaround from the treatment. So he came into my chair for a very strict 3-month recall of maintenance cleanings. Right off the bat, the first maintenance I had with him, I was making notations. There was heavy calculus buildup, there was bleeding everywhere, and he was already showing inflammation coming back. I really stressed oral hygiene. I showed him different things to use, how to properly clean his teeth at home. Some of the maintenance appointments, I even used a little topical anesthetic. In Texas, I'm not allowed to give local anesthetic, but I can use topical that'll just kind of numb the gums and try to help them tolerate the cleaning, because with his maintenance, it was a little more aggressive because I'm trying to get him all caught up and get that health back. So that went on for a couple years. It was definitely a battle, and I gradually saw things getting worse again. Despite, I promise you, I was cleaning that man aggressively, and he was so nice about it and would just tell me, do what you gotta do, help my teeth. But come this last summer, it just wasn't sitting right with me. He came in for another cleaning. He had some areas that had really gotten worse, bleeding everywhere, but his oral hygiene actually had improved. There was less buildup, less plaque, but still a lot of bleeding. And so my wheels were turning that something is not right. He needs more. What I'm doing isn't enough. And that's another part of being a hygienist, is being a detective. That's my favorite part of my job, is being a detective. I'm constantly looking at each patient. What's going on with them? What can be better? What do they need? What are their needs? What's best for this patient? So I called the doctor in and let him know, listen, for the last 2 years, this is gradually getting worse. I'm cleaning him. I'm going over oral hygiene with him. He's doing his part at home. It's just not getting better. So we gave him another treatment plan. The areas that were not surgical areas the first time around became surgical areas. And he had an area down here that it blew up. And so we decided that was priority. We really needed to do surgery there and do a little guided tissue regeneration. And what that is we put a little material down in there and put a little, it's like kind of like a Band-Aid over it, and we suture it back up, and it's helping that area rebuild bone and tissue to make it healthier. So we're trying to shrink that pocket, try to make it a little healthier. Patient came back for a re-examination with the doctor after that cleaning. He had not done his treatment yet. That area had gotten even worse. We diagnosed him with a chronic periodontal abscess. He still did not schedule treatment. He ended up back in my chair in October. And I sat down with him. I tried to be very sympathetic, very empathetic, share with him how much I cared about him, but I also shared with him how concerned I was that this was a real problem and he just couldn't keep it on like this because it was just going to get worse. So we went over treatment one more time. We decided to break it up, and I said, let's just prioritize it. You know, sometimes for patients, it's very overwhelming. They're scared, they're nervous, it's a lot of money. And so sometimes you have to prioritize, even though you want to make it all better at once, you got to pick the worst area and just convince the patient to start there. There's got to be a starting point. And so we convinced him that day to schedule treatment, and we did a little surgery over in this area. And so at the time of surgery, my doctor notated that he had 13 millimeters of attachment loss. That's that's a good chunk of that too. That's bone like coming all the way down. So imagine all that bacteria sitting in there, and his gum tissue was not reseeded. So he just had a big cesspool of bacteria down in that tissue. So here's my picture. It's a little fuzzy, but if you look in the corner between that corner tooth and then a back tooth, you can see it gets kind of dark red. It was a big bubble off his gum tissue, and that was just all infection. Right now, my periodontal charting is paper, so we use red for any measurements that we consider unhealthy. So this middle picture is when he first came in 2018. It's like all red numbers. He had so much disease. Over the years, it got better. You see less red. And then if you look to my picture all the way on the right, these are more recent. It started getting red again. So in his case, it's chronic ongoing periodontal disease. It's something he's going to have to battle. It's something I'm going to have to battle with him. So it's very important that he and I trust each other. We make a partnership, and this is something that I'm just going to have to monitor with him, constantly educate him on, and we'll just have to keep moving forward. It's very possible in the future he'll need surgery again, he'll need a deep cleaning again, but that's just something these patients really struggle with, and that's our job, is to just stay on top of it, continue to educate them, show sympathy, show empathy and compassion, help them trust you, and just try to keep them as healthy as you can. Case number 2, this is more recent. This patient was 37 years old. He was referred to us from a dentist for periodontal disease in October. And when he came to us, he mentioned he had never had a cleaning before. To be honest with you, that was very difficult for me to believe because he had dental work. He had some fillings in his mouth. He had a crown even, I believe, but there was calculus and plaque everywhere. He was severe, so severe that we couldn't even do a full charting on him without him being numb. So we looked at his x-rays, we did a visual exam and said, yes, you need scaling and root planing. We'll get you numb first and we'll get more accurate numbers. For this patient, we absolutely treatment planned oral sedation. By him saying he had never had a cleaning before, the severity of the pockets and the calculus buildup, we just knew it was going to be a very hard procedure for him. So he chose to do oral sedation for this procedure. They take a sedative. It's called Halcyon. They take that an hour before the appointment, and it helps them relax. They're not completely out, but they're very sleepy. Kind of like having a couple too many drinks is how I describe it to them. It usually makes them laugh. So he comes in very sleepy. So they take the sedative, they get in. This little picture on this slide is our monitor. So when our patients do any type of sedation, they have a total hookup to a monitor. So we do a blood pressure cuff, and it's on a timer. Every 5 minutes, I believe, a new blood pressure is taken. They are put on a pulse oximeter. So because the patient is sedated, they're more likely to have sleep apnea, any respiratory distress, it's going to alarm us if the blood oxygen levels are decreasing. And if that blood oxygen level goes below 90, I believe, it will start setting off an alarm. And that's our cue to start talking to the patient. This is conscious sedation, so they can respond to us. They are awake enough to respond and listen and do what we ask of them. And so if they start getting really sleepy and that alarm goes off, we just kind of shake them, we say their name, we take a pause, and we ask them to take a few deep breaths, and usually they're fine, and we keep going. So this patient was sedated. He did very well. So when he arrived, we always escort them to the chair. We never let them walk on their own when they've taken that medication. We get all their preoperative vitals taken, their height, their weight, when they last ate, their blood pressure, their respirations, all of that is taken before we start. Then we get them ready for anesthetic. So I'm usually trying to make sure they're comfortable. I'm talking to them in a soothing manner, making sure they're not too cold, they're not too hot. I want my patient to be as relaxed as possible. I don't want them to be nervous because they're about to get their whole mouth numbed up, and that part is not fun. So I place the topical, I'm there as a friend, go get my doctor, we get the patient fully numb, I give it a few minutes, and then I move along. So with this patient, we let him get numb, and then remember I said he was too uncomfortable for the probing, so I had to do a full exam before I started. I asked him prior to all of this if I could take photos, so I was able to take a pre-op photo and then a post-op photo. As I worked on him, I noticed generalized pocketing, which means like the little red numbers were everywhere. He had pockets everywhere, very heavy calculus buildup, tartar buildup. So for this case, I used my ultrasonic scaler almost the entire time. It was just that he stated he had never had a cleaning before. So this is years, 37 years of building up bacteria on the teeth. It was very difficult to remove. It was a very fun case though. I had a lot of fun. I just turned on my music and got to work. Throughout the procedure, a lot of times with patients that have heavy calculus, I'll remeasure throughout the procedure because I find as I'm removing the bacteria and the calculus off the teeth, the pockets are actually deeper than what they presented initially. With patients like that, calculus can be in the way. So my little ruler, my probe, it hits the calculus instead of going all the way in. So I like to take measurements throughout so I can get a true accurate measurement once I have that all cleaned off. It's not uncommon with these procedures, especially with a patient with his status, to have heavy bleeding. So a lot of bleeding with this patient. So being a hygienist in periodontics, that stuff can't scare you. It's not scary, you get used to it. At the very end, I take my hand instruments. I use Gracie's and curettes in this case to go up in those pockets and go on the roots. And what you're trying to do, imagine like bumps on your arm and you're just trying to smooth all that off. You want your instrument to slide across the root like glass. Any roughness is going to collect more bacteria and keep those pockets from healing as well. With this particular case, this was an interesting one, and this speaks to the importance of having all those monitors. As my patient was laying there hooked up to the monitor, so we hear the heartbeat, we get all these little beepings, and we have a screen that shows the heart rate, the rhythm, and everything. He had a arrhythmia while he was hooked up to our machine, and the doctor and I sat there for a little while and listened to it. It was nothing that was urgent and of concern, but it was definitely notable. We wanted the patient to know that we found this in case he had no idea, and he did not. So once that procedure was done, we definitely let him know what we found based on the monitors. And when he came back for his oral hygiene instruction, when he wasn't so sedated, we rediscussed it with him. So I'm very thankful for that. Unfortunately, the patient hasn't returned to us, but fortunately it's because we found that he's been seeing a doctor and they're monitoring his heart right now. So he's trying to get all that cleared up before he comes back to us. This case will definitely turn into an osseous surgery case. The pockets and the level of calculus was just so much that I know he definitely got a good healing result from what I did, but he'll definitely need more work. So here are my pictures from this case. If you can see this picture on the left, if you look down at those lower front teeth, it looks very bumpy, very gray. That's all calculus. And so the gums are pushed down. All that bacteria is pushing the gums down. It's taking over that area. Inflammation, you can see redness around the gums and around that where that calculus buildup is. This middle picture, you can say I'm weird. My coworkers laugh at me when I have a case like this and I get all that calculus off. I love to take a picture. It's just so satisfying to see what I did for that patient. Look at all that stuff I took off his teeth, and that's only a fraction of it. So it's so satisfying. So if you love this, you are meant to be a hygienist. This is the fun part. So the picture on the right, this isn't completion. It's just kind of working on those lower front teeth, taking all that stuff off. You can see some bleeding there. The tissue is definitely inflamed, but that's going to heal up really nice. If you look very closely, you can almost see a line at the end of the tooth going into the root, like the color of the tooth changes. So for this patient, he is most likely going to have some sensitivity. That gum disease went on for so long, he lost gum tissue as well. So he's going to have some recession there. That's the great thing about periodontics is if that tissue doesn't heal up and stay supportive, we can always do a tissue graft once he's healthy and stable. It was a really fun case. I'm looking forward to seeing where this goes. I hope he gets healthy soon and he returns back to us. Advice to our future dentists, hygienists, dental assistants. This is my advice for you. Don't be afraid to try new things. If I didn't try some of the things I was so afraid of, I wouldn't have experienced what I've experienced. I have so many stories to share, so many things I've learned over the years through different offices I've worked at, different doctors I've worked for. No two offices are the same. No two doctors are the same. You learn so much in school, but you learn so much more in practice. And there's so many amazing practices out there. There's so many amazing areas of dentistry out there. Don't be afraid to try new things and follow your heart. When I first started dentistry, I thought I wanted to go right into teaching. And I learned I love patient interaction. Then I thought I wanted to work in pedo. And my heart just kept going to adults and caring for people. I found myself really concerned with older adults and their overall health. And I've just been following my heart. I don't settle, and I do what I feel I want to do, what makes me happy. And care for your patients with empathy. I think that right there is what has made me such a successful hygienist. I have a great relationship with my patients. I truly care about them. I try to have empathy with everyone. Even if I can't sympathize with them, I try to listen. I try to be there for them. And they can feel that. They can read that. And it means so much to them. Dental anxiety is real, and so many patients have it. And just your empathy, your kindness, and your compassion will go a long way. It goes a long way with your doctor, and it goes a long way with your patients. And my ultimate favorite is teamwork makes the dream work. And I live by this. I always tell my boss that no job is beneath me. I will never say, I'm the hygienist, I can't do that. You're a team. I truly believe that working as a team, that's what creates a successful practice. That's what patients see, and that's what makes a happy work environment. Good luck to you all. Please feel free to reach out to me with any questions you may have. This was so much fun. I would be so happy to delve into other topics if you have questions on some things that I've said tonight. Thank you and good luck.
That was amazing. Thank you so much, Miss Heather Rich.
You're welcome. Thank you for having me.
Anytime. So it looks like we have a lot of questions in the chat, but I know we have like 5 to 10 minutes. So if it's okay with you, can we, read out a couple questions?
Yes, absolutely.
Awesome. Thank you.
Okay, so our first question is, what is the difference between an RDH, CRDH, MDH, etc.?
That's a great question. And I'm going to be honest with you. I don't know the specific differences. I actually saw that you had a CRDH earlier. My guess is it has to do with the state that you live in. So there are some states that allow for a certified hygienist, I believe. Education can vary. Most states, you have to go through a full associate's program at a university or a community college and then take a board exam. Some states do allow for, like I mentioned earlier, like a nurse practitioner program. It's called a dental therapist. Different states have different titles for it. Not every state has it. So it's kind of like in nursing, you have different levels of nurses. Dental hygiene is kind of going that route to where there are different levels, and it's really to create more access to care. Because in a lot of areas, like small towns out in the country, there's not as many dentists that want to practice there. They've created different areas of hygiene where you can do simple fillings, simple extractions. I believe that's the difference. I would love to research that a little bit more. I apologize, I don't know as much on that, but I would be happy to look into that for you and answer it on my Instagram.
Sounds good. Do you take less than 8 appointments if you have a 3-hour deep cleaning appointment?
Yes, I do. I'm sorry, I didn't clarify that. So if I have a scaling and root planing, that will take up 3 of those appointments. So no way, my day would not be that long. My doctors aren't that mean. No, if we have a root planing, it takes up 3 of those maintenance appointments. So instead I might have, for instance, I might have my 7:30 cleaning, maybe even an 8:30 cleaning to let the dentist get there and get started. And then I'll have the rest of my morning be a root cleaning. And then I'll take my lunch and have a few cleanings in the afternoon. So I'll have less patients in a day if I have a root cleaning appointment.
Did you ever consider becoming a dentist? Like, what's the big difference?
Yes, I did. So in my story, I did want to be a dentist, but as I got into like my college age, I really was intrigued by the hygienist. I think a lot of that actually was me being a coward, to be honest with you. I think I was scared. I was afraid of the big league. I was afraid of going the whole way. As I got into my hygiene career and I got my passion for dentistry, I really click with the dentist. I just truly love dentistry. I found myself working the way the dentist works, thinking the way the dentist thinks. And I love being the detective. So I love looking at treatment plans. And several years ago, actually, my husband did encourage me to go back to school and become a dentist, but my son's getting older. I have 4 kids. I'm getting older. And then we moved to Austin. And I just, honestly, I think this is what's best for me. Becoming a dentist is amazing. If I could go back in time, I might change my mind, but I'm very happy being a hygienist. It's kind of the best of both worlds. You get to treat patients, you can treatment plan with the doctor, but you don't have all the responsibility and liability, and you don't have to pay for the business.
That's great. Someone in the chat was wondering if once you get gum disease, you can't ever get rid of it.
So my answer to that is correct. Now, there are a few patients, if we catch it really early, we can do the root planing and I hate to say reverse it because we really do stand by that statement that once you have periodontal disease, you have it forever. Some patients, if bone loss is super slight and we catch it very early and they're a very proactive patient, we have a very proactive doctor, we can get those pockets back to what we consider healthy. And if they show stability, we will allow them to go back to a preventive state. But the number of those patients is very slim, especially in a periodontal practice. You might find that more in general dentistry where maybe, they see those patients at the early stage, but most of our patients, we're already seeing them after they've been through this with their general dentist and they're already at a severe stage where it's an ongoing thing forever.
How do you get to know like about all these new technologies? Does anybody train you to use them, or like?
That's a great question. For me, I think part of it is continuing education, of course. So as a hygienist, you carry a license, so you do have to take continuing education classes. That also varies by state. So right now in Texas, it's 24 hours every 2 years. So you learn a lot about that in the classes. For me, I like to build relationships and network with other offices. So I learn a lot about what they do in their offices. You learn a lot about it in school, but not as much. And if you're bringing the technology into your office, you do get training. So it's a variety. My advice is stay in the network, stay in touch with people, stay on top of your education, always be on the lookout for new things, because there are a lot of exciting things. And I can be honest with you, there's so much more out there that I probably don't even know about.
So it looks like that's all the time we have, Ms. Heather Rich. Thank you so much for
Okay.
joining. That
Thank
was an
you.
amazing and informative presentation. And I also want to thank all our viewers for tuning in. The quiz can be found on our link tree, and it can also be found on our group me. And yeah, thank you guys for joining. We really appreciate it. And once again, Ms. Heather Rich, thank you for joining.
Thank
and
you so much. This was so much fun. Y'all have a great night.
I hope everyone has a great night. Thank you once again.
Thank you.